Okay, it's 12 o'clock. I think we can get started. So first, welcome and thank you for participating today's CNPD Research Day. My name is Dr. Hsieh. I will be monitoring today's session. So in the interest of time, I think we can start get going. But before our presentations, I would like to play President's welcome videos and also welcome video from teams. So let me share my screen.
This is UND's President, Andy Armacost. I wish I could be there with you today. Unfortunately, I have an event with the State Board of Higher Education, so I had to be there. And I know today is the day where you get to present the results of your hard work, your research and your scholarship. So congratulations on all of your work. I know that you've put your heart and soul into the specific topics that you've studied. And this is a great day for you to showcase everything that you've learned to the people who are listening. So there's great things about this. One is the tremendous pride that you feel. The second is the opportunity to share what you've learned with other people. And so take advantage of this. It's a really exciting opportunity. Also know that events like this can certainly influence the career trajectory that you have. For me, it was the opportunity to conduct research and to present it that really led me down the path that I ended up taking in the world of academics. So enjoy today. Congratulations on your successes with your research projects and really enjoy this opportunity. Take care.
Hello, everyone. I am Dr. Diana Kostreski, Interim Dean of the College of Nursing and Professional Disciplines. Thank you for this opportunity to welcome you to this virtual research and scholarship event. The pandemic has brought us many opportunities. Hosting today's event virtually is one of them. To our student presenters, we appreciate your interest and effort in research and scholarship, and we look forward to your presentations. My very best to you today as you continue to shine. To all in attendance, we appreciate your support of our developing scholars. Thank you again and enjoy the presentations.
Okay, so those are the welcome message from the president and also from the dean. So let me remind you the guideline for today's presentations. So the order of the present will be in the alphabet order by the last names. And each presenter have 5 minutes and then followed by a brief Q&A or any feedback, probably 5 minutes. And then I will give you a verbal warning, like a 30 seconds warnings, will be given. And also, if you have any questions, you can type in the chat box. And so we can all read the questions. And then the session will be recorded. And also another reminder, our students are at all stages of research. So, and also that you can see the type of research today will be varies. And so I think it's time, let's get started. I think our first presenter on the list is Destiny. Is Destiny here? I don't think so. And so let's move on, Taylor. So Taylor, I would pass it over to you so you can start whenever you are ready.
All right, can everyone see that okay? Perfect. My name is Taylor Culliver. I am a nursing student in my second semester. I have conducted my research with the Marquis Star program under the advisement of Dr. Darlene Hansen. And today I will be presenting this literature review on blood pressure education and the effectiveness of alternate teaching methods versus traditional teaching. So, nearly half of all adults in the United States experience hypertension, and blood pressure assessment is the diagnostic tool used for hypertension. Nurses are expected to have proficient knowledge in this assessment, though In 2013, Rabia et al. Found that out of 160 nurses, 95% were unaware of the proper techniques when implementing blood pressure. This compromises patients' safety and quality by potentially exposing them to ailments such as ischemia and stroke, if not treated properly. To correct these inaccuracies, foundational education is needed in a pre-licensure level. And with the need for physical distancing this past year, alternate teaching methods were implemented, though information on the effectiveness of these teaching methods were lacking. Alternate teaching methods such as virtual, web-based simulation, and online virtual simulation allow students the ability to enhance their skills on their own time and receive immediate feedback. This is compared to traditional teaching, in which a lecturer educates on the fundamentals of blood pressure face-to-face with students. The purpose of this literature review was to assess the effectiveness of blood pressure education utilizing virtual, online, and simulation versus traditional teaching in baccalaureate programs of nursing. Due to the scarcity of relevant topics, two search strategies were utilized. First, we used Janell complete with Medline, and the terms used were blood pressure measurement, competency, and nurse with 12 results. And then PubMed was used with the search term skills, virtual nursing students with 179 results. Articles must have included English, full text, and have been sourced from 2012 to 2020 to be included in the literature review. And articles that contain studies of practicing nurses, gray area pieces such as dissertations and conference papers were excluded. So after refining the search, 7 articles remain of varying levels of evidence. It was found that alternate teaching methods enhanced blood pressure education in students 3 out of the 7 articles, and confidence was enhanced in 5 out of the 7 articles. In the Gordon et al. Study in 2014, which tested the effectiveness of simulation groups versus traditional education, did find that there is no significant difference between the 2 experimental groups, though it was found that confidence was enhanced. A theme that highlighted this literature review was that relevant studies were scarce. This brings to light the importance of research with higher levels of evidence in order to validate the effectiveness of alternate teaching methods in blood pressure education. During such a time in which physical distancing requires students to learn blood pressure online, this is very necessary. Another implication is that virtual terminology needs to be refined. Terms such as virtual reality, virtual gaming simulation, and online simulation have very similar definitions, though when searched individually, they can come about with variable results. Term refinement is needed in order for future scholars to have more clear and concise searches. Alternate teaching methods should also be implemented into training for nursing students. It should be noted, however, that instructors must have proficient knowledge in the technology that they are utilizing. And lastly, blood pressure should be an assessment that is demonstrated regularly for current healthcare providers. Alternate teaching methods can be an appealing option for them due to allowing them to enhance skills on their own time and allowing for flexibility in rigid schedules. Thank you.
Any questions? We have some time for Q&A or any feedback. We appreciate. No? Okay, we can save for later. So if no further questions, anyone type in the chat box? No? Okay, that's fine.
I would like to ask one question. Sorry, I didn't get time to put it into the chat. Can you talk about your experience with just trying to do a literature search like this for the first time?
Yeah, so this was my first literature review, and some difficulties that I faced were making sure that anytime you make a search to note what terms you use, what results came about that, and different exclusions I used to refine the search. And it took us a pretty long time, about a month or so, for us to get down and narrow these search terms in order to produce the results that we had. It was pretty time consuming and difficult to be able to find topics that were relevant because especially given that we wanted to focus mainly on blood pressure education, there was a lot of information, or there was not a lot of information regarding that specifically. So we were discussing whether we should open it up to education on like nasogastric tubes or open it up to vital signs in general. So that was something that was pretty difficult. And I learned a lot from doing this search.
Thank you.
Any other questions or feedback? Okay, then we can move on to the next presenters. Could you stop sharing? Okay, good. All right, thanks. All right, so our next presenter will be Courtney. Could you share your screen? I will turn it over to you.
Can everyone see my screen? Perfect. So my name is Courtney Haviland. I am a licensed social worker in the state of North Dakota, and I am currently a Master's of Social Work student at the University of North Dakota. My research proposal is to identify the prevalence of alcohol and substance use among juvenile justice involved youth in the state of North Dakota. So in this, I want to address and find what is successful to address adolescent alcohol and substance use. And I want to do this by using the adolescent perspective, only from juveniles in the state of North Dakota. And with this, I want to identify successful treatment options available. And this will identify different themes that will make treatment successful and making recommendations for treatment programs. So that will help service providers in the future implement better treatment options and what has worked for kids in the past. And this will all be done through juvenile court identified youth who have previous experience with alcohol or substance use in this state. So this will include knowledge of understanding what juvenile drug court is and how kids are referred to that through juvenile court, the prevalence of alcohol and substance use among youth. And it was found that there are 2.1 million youth arrested each year with any form of citation. So that can be like a truancy through school, that can be an unruly, a disorderly conduct, or any citation a youth gets when they have contact with law enforcement. And of those 2.1 million youth, 11.2% were charged with drug violations. And that is a national statistic. There was not any statistics released for the state of North Dakota on how many were arrested because of drug crimes. It'll also include discussing the risk and protective and promotive factors that lead youth to use substances, as well as what helps them to remain sober. And then it'll include previous research on these rates and the prevalence. And North Dakota has higher rates nationally for youth substance use. There is nothing currently published on why that is. So the methods that will be used to complete this research, participants will be juvenile court identified youth. So these are youth who are already on probation. And when a youth is put on probation, they fill out many different assessments and questionnaires. And within those assessments, it is identified if they have a substance or alcohol use history. And so I will be using, or the researcher will be using, those youth who have identified to use substances. And this will be done with purposeful sampling because we will solely be using the youth who were identified to use substances. And to start this, it'll be done within the Grand Forks area, so the Northeast Central Judicial District Juvenile Court. And so once the youth have identified to participate, they will fill out a demographic questionnaire, and this will include rates of how many youth have ever used substance and alcohol. And some example questions are, have you ever been to treatment of any kind for substance and alcohol use? And are you currently in treatment of any kind for substance or alcohol use? And these will have a yes or no scale answer. And then after the questionnaire is completed, they'll complete one-on-one interviews. And the goal of this is to identify successful treatment options and experience the youth have had. So if they've been to treatment, what was their treatment like? And also identify themes and recommendations for interventions that have been effective, as well as what risk factors these youth had, and then protective and promotive factors that have led them to remain sober after treatment. And some example questions on the one-on-one interview are, how many times have you accessed treatment of any kind for alcohol and substance use? And if you've been to treatment of any kind, what did you find helpful? So the anticipated results are to understand common themes,
Thursday, that's what that is.
the impact of treatment success and the
30 minutes.
effectiveness, as well as the prevalence of youth, alcohol and substance use among North Dakota youth. Since this is only being done in the Grand Forks area, ideally, once those rates are found, it could be spread throughout the state and the various juvenile courts throughout North Dakota. And of those results, it'll be used to shape successful treatment programs, so implementing interventions that have been proven to be more effective, and then as well as identify rates at which youth access the treatments available. Some of the limitations that were found is that within Grand Forks, it would be a very small sample size. There's not published statistics on how many youth are currently on probation and use substances in Grand Forks Juvenile Court, but it could produce a sample size of 15 to maybe 25 participants, and ideally there would be.
I'm sorry to interrupt you, but I think time is up. But we can open for Q&A and any feedback.
Would you mind sharing your screen again on that second PowerPoint?
Can you share the screen again so we can see?
Yep. On the introduction one.
And then the next one. Was it difficult in because you're dealing with youth and accessing young people for this?
I'm sorry, can you repeat the question?
Was it difficult accessing young people or youths because you know, that's who you were targeting? Was it difficult to access them because of issues with them being minors?
So ideally, they when they're identified and referred from juvenile court, they would complete consent forms with their parents. But because they are minors within the state of North Dakota, there's not research and statistics published because their records of juvenile court disappear when they turn 18. So finding those statistics and working with the youth population has been proven to be difficult.
Thank you.
So I have questions. So in the systems, is there any like a screening questions or everyone in this process would kind of take or being asked?
So when a youth gets put on probation, they have screening assessments. There's 4 different assessments that a youth has to do with a probation officer. And so they're identified through those assessments, and that asks about their past, their history, their juvenile record, their substance use, alcohol use, any mental health, physical health. And so all that's identified within juvenile court already.
Okay, any other questions, feedback? Okay, if no questions, could you stop sharing your screen? And we may move on to our next presenters, which is Janell. Are you here? No. Okay. How about let's move on our next one. Alex. Okay, you are here. So I would just you can share your screen.
Okay. Is everyone able to see that okay? So my name is Alex Schulz. I'm a licensed social worker in the state of North Dakota, currently working on my MSW through UND. And my research proposal is about evaluating the impact of comprehensive sex education on LGBTQIA acceptance in rural communities. So for some background information, comprehensive sex education is one of the different forms of sex education that can be offered.
Can I interrupt you? The screen is black. So,
oh, is it not? It's showing up on mine, but
can anyone see or just me?
Nope, it's black on my end too.
Yeah, that's black. Will you just,
it is.
Alexandra, will you just double check your share screen and make sure the one you're sharing is your PowerPoint?
Yep. Here, let me.
Can you try again?
Yep, working on it. 1 second. Can everyone see it now or?
It's still black.
Nope, black.
Still? See if it works.
I have your slide. If
yeah,
so,
it might just work
working,
better.
Yeah, it's not working. So let me try. I can do it at my end to see if it works. Okay. Then. Okay. Can you see? Can you see now? Okay.
Okay, perfect. Sorry about that. So anyway, comprehensive sex education is a type of sexuality education. There are different types. Abstinence only is one that's really common. But comprehensive sex education is a programming that aims for more than just like pregnancy reduction and disease prevention. It also educates on how to make healthy decisions, relationships, all sorts of stuff like that. And it also educates on the different variations that people can experience with their gender and sexuality. And my thought is that the research question there is that does exposure to LGBTQIA topics such as gender and sexual identities and the variants in that reduce instances of negative reactions to those who identify as LGBTQIA and potentially increase acceptance of those individuals. So that's what I'm looking to do with this study. So if we go to the next slide, please.
Do you want to hit the next?
Yes, please. Yep. Perfect. Okay, thank you. So this is for the proposed research. So the participants, I'd like to have 2 groups of students starting in kindergarten, so roughly ages 4 to 6, and then ending when they're high school seniors, roughly 17 to 18 in rural North Dakota. One group will receive the comprehensive sex education programming, and the other group will receive the non-CSE programming, or basically what is currently offered in North Dakota. So modified interviews with participants will be done in K through 4th grade. And then interviews and surveys that are age appropriate will be implemented with participants 4 and up. So one way to kind of gather if this content exposure is making an impact on like younger kids would be to hold up a picture of like a boy and a girl, and like a boy and a boy, a girl and a girl, and ask them, you know, what are your thoughts on this? Something along those lines, just to assess, because we can't do a lot of like questionnaires with little kids, obviously. So assessments will be completed at the end of each school year. And then I'd like to track the changes in their responses to both the surveys and the interviews to measure growth or decay in their acceptance and their attitudes towards LGBTQIA individuals. And then next slide, please. So it's believed that CSE can have beneficial impacts outside of disease prevention and pregnancy reduction. And early and continuous exposure to LGBTQIA topics presented in an age-appropriate, affirming way through comprehensive sex education will help normalize these topics and increase empathy and acceptance of individuals. And research has actually shown when they've asked like LGBTQIA adults what they think has contributed to people becoming more accepting as time has gone on, because we know our society has changed in our acceptance of gender variance and sexuality variance. A lot of it they attributed to people knowing someone that was gay or, you know, part of that community, and that familiarity helping them reduce those negative stigmas. So that's kind of where the inspiration for this came from. So I think that the early and continuous exposure will help lower rates of homophobia, transphobia, hate crimes, and then as the participants age and become of voting age, anti-LGBTQIA legislation, which we've seen during this legislative year. And then some limitations of it, the longitudinal study is expensive and kind of difficult to maintain, and then there's the potential loss of participants over time. So that is my presentation.
Okay, any questions, feedback? Oh, it's checkbox. Oh, what difficulty do you anticipate in getting study permission?
Sure. So that's one of the things that I kind of discussed in the actual paper itself, but didn't really put on here. So some difficulties. This is a sensitive topic, and North Dakota is a more conservative state. So finding parents that will consent to their children being part of this is definitely a barrier. And then finding a school system to participate in it. However, I think, you know, with enough education and enough discussions, I think that it could be accomplished. It definitely is a barrier though, just the topic itself and working with kids K through 12.
And I have a question. So is there any existing kind of curriculums that, you know, in school systems, or any kind of conversations already?
Yeah, so sexuality education varies from state to state, and honestly even district to district throughout the United States, because there's not a standardized expectation. So different states have different things that they talk about. So there is actually a resource that compares the sex education policies throughout the different states in the United States. And certain areas such as like California, for example, have more comprehensive policies and talk more about like relationship building and LGBTQA individuals, healthy decision making, that sort of thing. So it would kind of be implementing that, but also adding in more of a focus on this research topic to kind of evaluate that, because this is mainly to see if that will do that, but also or to accomplish the goals of this research, but also to have a positive impact and educate kids about healthy decision making. So.
Any other feedback or questions? Anyone? Very important topics. Okay. Anyone feedback or comments or questions? We still have some time. How about could you give some example? How do you measure the increase in empathy and acceptance? And what's your plan?
Sure. So part of what my plan is I believe that, as kids age, the kids are born into this world and we've seen it, like they're very accepting of people. They don't really question much. It's once, they start seeing what's on the news and what's in the media and what their parents and like their households, religious communities believe. That's when we start seeing this change in, these people are more okay and these people are less okay. So my thought is, by comparing kids at the same level, in the same area, same kind of demographics, and seeing, okay, if they're exposed to these, positive portrayals and fact-based things, if that has an impact on their kind of like friendliness towards these sort of topics. So my thought is that the kids that are not exposed to the CSE programming, we're going to see those changes and that impact in like a rural community setting, for example, by asking them, for like the question that I brought up earlier with the little pictures for kids, and seeing, is there a change? Is there, what's their attitude like towards this instead? So my assumption is that when they're younger, they're going to, not really register a difference. And then as they get older, asking them, what type of relationship do you think these people have? And if they automatically go, oh, they're just friends. Or if they're like, well, they could be friends or they could be, a couple. That's kind of how I'm thinking that that'll be measured. It'll be a little difficult, but as they get older and they can fill out responses to the questions, I think that'll show more of like their thought process and how it changes and evolves over time.
Okay, thank you. So I think this we have two presenters are not here today, so we can open Q&A to give feedback or comment or question to the three presenters. Anyone? Do you have any let me stop share my screen. Do you have any questions or comments for our three presenters today? Okay, so I think we can, stop earlier today. And so thank you for joining us for today's sessions, and we appreciate the work of all of our presenters and also appreciate the participations of the standing faculty. Thank you, everyone.
Oh, wait.
Hello, Dr. Hsieh.
Yes.
Yeah, actually, my student from 317 just joined to watch the presentation. Do you think if there's any way that one of the presenters just, present their, study one more time? Because coincidentally, today's class is about reporting research. So yeah, and we start just 12:30. So if there's any chance or any volunteer from today's presenters, I'm wondering if I can ask that.
Yeah, the session is ended.
No, I know.
Well,
Yeah, I just
we still have a few minutes. We have 25 minutes. So if the previous presenters want to present again so that the students who join can see their, kind of work in action, I think that would be wonderful. Can we get a
Yeah.
volunteer from somebody who would be willing to do that?
Yeah. I think today we have 3 presenters and 1 left. So we have Alex and Courtney, and they are our they are social work
students.
Yes. So
is there Taylor?
so any volunteer, Alex or Connie, could you present again since we have time left? And this is our social work students. So are you there?
I can again, if you'd be willing to share your screen again, since my
That'd be
screen share
wonderful.
doesn't work.
Thank you so much. And sorry to put everybody on the spot, but this is, sort of the nature of virtual presentations. So yeah, we're happy to do that. Did Taylor presented as well, right?
Is Taylor still here? Oh, yes.
Yep, I'm still
Okay.
here.
I just didn't want to leave you all if you wanted to jump in as well.
Okay, so I know you have probably shared your screen, so let me share mine.
Okay, so my research proposal was on evaluating the effectiveness of comprehensive sex education on LGBTQIA acceptance in rural communities in North Dakota. So comprehensive sex education refers to a type of sexuality education that is more comprehensive. It's more inclusive of different topics. It is fact-based, science-based, evidence-based. It is shown to actually have very positive results on disease prevention, pregnancy prevention, but there's not a lot of research, not really any research showing on how it impacts people's perceptions of those that are often perceived as like different. So in this case, it's the LGBTQIA community. And comprehensive sex education does teach about gender and sexuality variance, which abstinence-only education is another popular form of sex education in the United States. That does not really talk about that, and it focuses more on just abstinence, whereas comprehensive sex education focuses on like relationship building, empowering youth to make healthy decisions, that sort of stuff. And research has shown over the years, and we can even see in like our society, it's become more accepting of LGBTQA individuals, such as allowing them the right to marry. But we're not perfect yet, and we're still working on it. And I think that by exposing kids from K through 12 to this in a positive, just fact-based way, can have a positive impact on that. So my research question is that if exposure to LGBTQIA topics such as gender and sexual identities and the variance in that, if that'll reduce instances of negative reactions to those who identify that way and potentially increase acceptance of those individuals within these rural communities. And then Yiping, if we go to the next slide, please. Thank you. So the participants for this, there'd be 2 groups of students starting in kindergarten, roughly ages 4 to 6, and then it would end when they're in high school, so 17 to 18. And this would take place in rural North Dakota. One group is going to receive comprehensive sex education programming, and the other will not. They'll receive what is currently offered in North Dakota, which is just kind of, it has a more abstinence focus. It's not necessarily abstinence only, but that's kind of what they primarily teach. So the methodological approach, there's going to be modified interviews with participants in K through 4th grade, and then interviews and surveys that are age appropriate will be offered to participants 4th grade and up. And like for the younger kids, the K through 4th graders, obviously we can't sit down and have them fill out a survey, but we can do like a little interview with them and kind of gauge where they're at with this. So one way to do that would be to show them a picture of like a boy and a girl and a boy, or a girl and a girl and a boy, and kind of ask them, what do you think of this, that sort of thing, and just kind of gauge their reaction that way. Assessments will be completed at the end of each school year. That's how progress will be tracked. And then we'll measure changes in their responses to both the surveys and the interviews to measure growth or decay in their acceptance. And then next slide, please. Thank you. So the implications, it's believed that CSE it's believed that it can have beneficial impacts outside of disease prevention and pregnancy reduction. That's a lot of what people focus on with sex education, but there's a lot more to that. And I think there can be a lot more to that. So early and continuous exposure to LGBTQIA topics presented in an age-appropriate, affirming way through CSE will help normalize LGBTQIA topics and individuals and increase empathy and acceptance for those individuals. And I think that this will lead to lower rates of homophobia, transphobia, hate crimes, and then anti-LGBTQIA legislation as the participants age, because these kids grow up to become our policymakers and our political leaders. And I think that exposing them to this and creating more empathy will actually help reduce instances of like negative policies, which we've seen in North Dakota in this legislative session and throughout the United States. And then some limitations of this: a longitudinal study from K through 12th grade is expensive and difficult to maintain. And then there is obviously the potential loss of participants over time due to them moving or dropping out of the study. And then also one of the questions asked earlier was, other limitations. Getting parental consent for this is difficult because in North Dakota, we are more conservative, and, that's okay, but it's difficult to recruit people for that because it is a sensitive topic. And then also finding a school district to work with will be difficult, but I think it can be done.
Thank you, Alex. Do you mind if I have some follow-up questions?
Sure, go for it.
Yeah, the first one is that, first again, thank you for, volunteering to present your research again for this research, method course student. First one is that, as far as I know, you are a social worker, right, already. So what made you interested in, working on this topic? And then the second one is that, do you have any future plan to actually, adapt this program for your current or future clients?
Sure. So for the first question, this is something that I've kind of always been interested in. And actually, when I was getting my BSW degree, I did a macro level placement at CAUSE, North Dakota, Council on Abuse and Women's Services. And that was during the 2017 legislative session. And there was an anti-discrimination bill that was introduced. And I sat through all the testimony for, I think, 8 hours that day. And seeing how positive there was a lot of testimony in favor of the bill, and there was a handful that was against it, and the handful that was against it won. So we still don't have that anti-discrimination bill in place. So that kind of started me thinking on how can we make changes in our society in North Dakota to help protect this very vulnerable population, this marginalized population. And then obviously this year was a legislative year also. And there was the trans sports bill that was introduced, and there was a lot of bills such as that introduced throughout the nation. And that was kind of my catalyst for this, was how can we affect change in the younger generation so this doesn't continue to happen. And then for your second question, I would like to do this study. I'm not quite sure how that'll work because kind of my goal is to actually work with adults, but obviously, kids become adults. So this is something that I'm looking at doing. I'm not sure when or how, but it is an option for the future.
Thank you.
Thank you. So I think we still have time for another volunteer. So Taylor or Courtney, are you willing to present your work again? Okay, there.
Work again.
Okay, thank you. So you can share your screen.
Yes.
Yes.
I want to just make sure I have my cards all in order. So I am Taylor Culliver. I'm a second semester nursing student, and I presented my topic on blood pressure education and the effectiveness of virtual alternate teaching methodologies versus traditional teaching. So to begin, nearly half of all adults in the United States experience hypertension, and the primary way to diagnose hypertension is through blood pressure administration, which nurses are expected to have proficient knowledge in. Though in 2013, a study done by Rabia was found that as many as 95% of nurses in a hospital were unaware of the proper techniques of implementing blood pressure. This can compromise patient safety and quality by potentially leading to ailments such as stroke and ischemia, if not properly treated. To correct these inaccuracies, it's important to have foundational education within a pre-licensure nursing setting. And with the need for physical distancing this past year, alternate teaching methods were implemented, though information on their effectiveness has been limited. So alternate teaching methods such as virtual, web-based simulation, and online virtual simulation allow students the ability to enhance their skills and receive immediate feedback. This is compared to traditional teaching in which a lecturer educates on the fundamentals of blood pressure, usually on campus, face-to-face with students. So the purpose of this literature review was to assess the effectiveness of blood pressure education utilizing virtual, online, and simulation versus traditional teaching in baccalaureate nursing programs. Due to the scarcity of relevant topics, multiple searches were used. So Janell with Medline was used with the terms blood pressure measurement, competency, and nurse with 12 results. And then PubMed was used with the search term skills, virtual, and nursing students with 179 results. Articles must have been in English, full text, and sourced from 2012 to 2020 in order to be included in this literature review. And then articles were excluded that contain studies of practicing nurses, and then gray literature such as dissertation and conference pieces. So after refining the search, 7 articles were found to remain relevant. And then it was found that alternate teaching methods were as effective as traditional teaching for enhancing blood pressure education in 3 out of the 7 studies. And 5 out of the 7 studies found that confidence was enhanced. It was noted, however, in the Gordon et al. Study in 2014, which studied the effectiveness of simulation versus traditional teaching, found that there was no significant difference, though confidence was enhanced in that study as well. So a theme that was highlighted throughout this literature review was that relevant articles was lacking. So it is needed for higher levels of evidence to validate the effectiveness of these alternate teaching methods. And in such a timely period, this is important because many nursing students are learning blood pressure administration online. Another implication is that virtual terminology needs to be refined. Terms such as virtual reality, virtual gaming simulation, and online simulation have very similar definitions, though if you search these terms individually, you can come up with some variable results. So term refinement is needed in order to make searches for future scholars more clear and concise. Next, alternate teaching methods should be implemented into training for nursing students. It should be noted, however, that professors must have proficient knowledge in the technology that they're administering. And then lastly, blood pressure should be an assessment that is demonstrated annually for current healthcare professionals. And alternate teaching methods can be a really appealing option for them due to allowing them to enhance their skills on their own time and increase flexibility within their schedules. Thank you.
Thank you, Taylor. Do you think I can ask you one question about your research? First, thank you for, actually introducing this review study. I believe that this is really important step, actually, right, to map the literature and identify gaps in the literature. So Taylor, I also see that your topic is really, really relevant, particularly this, COVID-19 era, like doing it virtual. So my question is that what is then your next research project? I know that research, it's quite related to also practice and clinics, right? Clinical experience. So I'm just, wondering what would be your next step?
So for this, the next step is going to be actually comparing blood pressure education and med students versus nursing students and using a program that was created to be an implement to the current curriculum. So there'd be a test with a control group where it's just your traditional teaching with a lecturer, and then you can have a experimental group where it will be the program with the traditional teaching. So then we will test the effectiveness of the program in that way.
Thanks.
Yes, thank you.
Thank you.
Okay, we have 10 minutes. So do we have another volunteer? Courtney, are you willing to represent your work?
Yep, I can do that. So my research topic was on the prevalence of alcohol and substance use among juvenile justice involved youth in North Dakota. So the goal of this research was to find what is successful to address the adolescent alcohol and substance use from an adolescent perspective within the state of North Dakota. And that will include finding successful treatment options available, identifying different themes that would make treatment for youth successful, and making treatment recommendations for existing treatment programs for juvenile justice involved youth who have experienced or are currently using alcohol or substances within North Dakota. So this will include understanding the knowledge of juvenile drug court and how youth get involved with drug court, the prevalence of youth alcohol and substance use. Nationally, 2.1 million youth are arrested each year, and of those 2.1 million youth, 11.2% are charged with drug violations. There's no released statistics on North Dakota, so that is a national statistic. It'll also include understanding risk, protective, and promotive factors that lead youth to use substances, as well as how they remain sober after treatment. And then finding previous research, and it's found that North Dakota has higher rates nationally for youth substance and alcohol use than any other state. And so the methods that'll be used are participants are identified through juvenile court. When they get a citation and are placed on probation, youth have to complete various assessments. And on those assessments, substance and alcohol use history is identified. And if those youth have previously used or are currently using, they will be used in this study as a participant, and it'll be used as purposeful sampling because the researcher will solely use the youth who have identified to use substances. These participants will complete a demographic or a questionnaire and a one-on-one interview. The questionnaire will include demographic questions as well as rates of how many youth use substances, and I provided example questions. So the questionnaire will be yes or no scales, such as have they been to treatment and are they currently in treatment? And the one-on-one interview will identify if they've been to treatment, what was successful, recommendations on what could be improved if they did not find it successful, as well as identifying specific risk factors to each child and protective and promotive factors. And some example questions of that are, how many times have you accessed or been to treatment of any kind? And if you've been to treatment, what was helpful? So some results are understanding themes and impact of treatment effectiveness. So that can be used to provide recommendations for existing treatment facilities to make improvements and make it more effective for youth throughout the state, as well as finding statistics on how common this is throughout the state, since there's little research completed for that or not published. And then this will help treatment programs be successful for youth in the future, and as well as find rates at how many youth access treatment and complete treatment. And some of the limitations of this is, since this is only being completed with juvenile court identified youth, and then within like the Grand Forks community, there's a smaller sample size, so it can't give us an accurate representation throughout the state. But if the study goes well, the goal would be to implement it throughout North Dakota and then use those to shape treatment options. And if it goes well throughout North Dakota, provide this on a national level.
Thank you, Courtney. So here I am again. I have one, question for you. So thank you for, already, telling us what your next step would be. And also personally, what I appreciate about your presentation is that you really well demonstrated how this intervention research should be conducted in a rigorous way. So that's quite relevant to student from this research method course. So thank you about that. And also personally, I am interested in this substance use, topic. So again, Courtney, you are also a social worker. So what made you interested in this topic and or population?
I currently work with at-risk youth, and my internship for undergrad social work was at Grand Forks Juvenile Court. So I learned more about that population and realized within my current role that this is a much bigger problem than it's been identified, and there's not much to do in the state of North Dakota to help. So the last budget that was released eliminated a lot of treatment programs for youth. And that could be because there's a lack of research, so people don't know how relevant this is. So identifying that there's a need and then implementing those programs throughout the state, I think would have been beneficial.
I agree. Thank you.
Okay, we appreciate the work of all our presenter, and also the second time present even getting more exciting, and we learn a lot from that. Thank you for being willing to do that, and also thank you for your participations in our session today. So I think this is a good ending. So thank you everyone. Bye.
Thank you, Dr. Hsieh, again for moderating the session. Yeah.